Bone augmentation is a typical process in implant dentistry. It seeks to improve jaw bone density for the purpose of ensuring success the placement of dental implants. In this clip, we'll talk about the role of bone augmentation for implant dentistry and the ways it may improve the outcome of dental implant surgeries. What is bone augmentation? Bone augmentation is also referred to as bone grafting, is a procedure whereby you add bones or bone substitutes in areas of the jawbone that have a low bone density. This is often required due to many reasons, including tooth loss, periodontal illness, as well as trauma or congenital problems. In the absence of adequate bone density, dental implants might not fit well into the jawbone, leading to failure of the implant. There are many different kinds of bone augmentation procedures, such as autogenous bone grafting. This is the process of taking bone taken from other parts of the body, for example, the hip or chin, and putting it into the jawbone. Allografts, bone transplants from a donor and reprocessed to get rid of the potentially harmful substances prior to being placed into the jawbone. The xenografts are bone grafts that have been taken from cows or other animals that are then processed to get rid of the potentially harmful substances prior to placing it inside the jawbone. Synthetic bone grafts. These bone grafts are made using synthetic materials, including calcium phosphate, to mimic the functions of the natural bone. Why is bone augmentation important in implant dentistry? Bone augmentation is essential for implant dentistry since it serves as a stable basis on which dental implants can be put in. In the absence of adequate bone density, implants for dental use may fail to osseointegrate effectively, which could lead to implants failing. In enhancing bone density by osteoporosis, dentists can enhance the efficacy of dental implant procedures. This will make sure that the stability and longevity of the implants. Bone augmentation can be particularly important for patients who are suffering from severe bone loss as a result of tooth loss, trauma, or periodontal disease or congenital deformities. When this happens, it is essential to improve the bone structure prior to when dental implants can be put in. Without bone augmentation, implants could not provide sufficient strength to handle the force of speaking and chewing. This could lead to the implant failing. A bony augmentation procedure can to improve the appearance and aesthetics from dental implant surgery. If the bone's density is not sufficient, it can appear hollow or swollen, leading to a tired or unattractive appearance. In enhancing bone mass through dental augmentation, dentists will be able to make a more natural-looking and youthful look for those with lost teeth or have experienced substantial reduction in bone. How is bone augmentation performed? Bone augmentation usually occurs in a minimal surgical procedure within a dental practice or in an outpatient clinic. The procedure can be carried out under local anesthesia or general anesthesia or with sedation according to your patient's requirements and the degree of enhancement of bone required. The dentist makes an incision into the gum tissue to expose the bone beneath. The bone graft tissue will be placed within the region of deficiency in bone and then secured by pins, screws, or sutures. The wound will then be sealed with sutures, and the patient will be provided with instructions following the procedure for treatment and recuperation. After augmentation of the bone, it is necessary for the patient to wait for enough time for the graft to heal before it can be incorporated into the bone tissue. The process is called osseointegration, lasts several months before it is completed. When the bone graft is completely joined, the dentist may move on to installing dental implants within the bone that has been augmented. Benefits of bone augmentation in implant dentistry. There are numerous benefits to implants that increase bone volume, which include a higher rate of success in dental implant surgeries and enhancing the density of bone through implant augmentation. Dentists will be able to enhance the effectiveness of dental implant surgeries and lower the possibility of implant failing. Long-term stability and function of dental implants. Bone augmentation creates the solid base for dental implants. It ensures longevity and the functionality of the implants. Enhances aesthetic results. The bone augmentation could increase the aesthetic results from dental implant surgery and create a more natural and younger-looking appearance for patients. The jawbone structure is preserved. The augmentation of bone helps to keep the jawbone structure intact and stop further loss of bone, improving oral health and functionality. Bone augmentation plays a vital function in implant dentistry through improving the bone density of the jaw, which is essential to ensure effectiveness of dental implant surgeries. In establishing a stronger foundation to support dental implants, the dentist will be able to boost the rate of success for implants and ensure the stability and long-term functionality to patients. If you're thinking about dental implants but have not enough dental bone density, discuss with your dentist about the possibilities enhancement of your bone to boost the outcome from your dental implant treatment.